The manufacturing of gene therapies is highly complex and requires significant investment. Currently, chronic therapy for SMA can cost the healthcare system tens of millions of dollars over a patient's lifetime, and we are confident that Zolgensma has the potential to reduce the long-term financial burden for patients and for the families and for the healthcare system overall. And we think that's where ultimately the value is and why we believe our pricing approach is appropriate. It is not our intent for any families to self-pay for Zolgensma. We also recognize that these crowdfunding situations create a new and challenging dynamic for all involved. It's the responsibility and obligation of the ministries of health and governments to care for the health and well-being of their citizens. Of course, our hope is over time that with additional facilities licensed to manufacture Zolgensma, we're able to realize efficiencies in this process. But for now, we're still very much working on a first-generation technology, and will take us a number of years until we can consider how to reduce costs through manufacturing. One-time gene therapies are designed to provide a lifetime of benefit and therefore are potentially curative. Right now, we cannot consider Zolgensma to be a cure, but clinical trials have shown significant clinically meaningful therapeutic benefit in both patients who don't yet have symptoms and in patients who are displaying symptoms of SMA. We saw in our SPRINT trial, patients treated before symptoms emerge are achieving age-appropriate motor milestones on pace with their peers who do not have SMA, including milestones like independent sitting and walking. All data from our clinical trials to date demonstrates prolonged event-free survival, achievement of motor milestones unseen in the natural history of the disease, and sustained effect 5 years post-dosing. And that's as long as we've been able to study patients so far, but these patients are continuing to grow in age. We are seeing symptomatic children treated in our clinical trials roll over, sit independently, stand, and even walk sometimes. And a few are even starting school this year. The European approval came 1 year after the United States approval. So the European health authorities had much more data and a much longer time to review that information before approving the drug. The earlier we treat patients, the better they will do. So certainly Zolgensma will perform better in general on a patient who is treated at a younger age than one who may be treated at an older age. However, we do have limited experience in patients over 2 years of age at this point. All available data demonstrate that Zolgensma delivers transformative clinical benefit without the need for add-on therapy. At the same time, we know ultimately the decision to treat a child with Zolgensma or any other SMA therapy lies with their treating physician. And parents want to achieve as much as they possibly can for their child. So we do see examples of combination use. But unfortunately, we still don't have data to understand if that is a benefit or not. We treat around 100 patients with Zolgensma on a quarterly basis. And we've now seen to date more than 700 patients have been treated worldwide across our clinical trials, managed access programs, and in the commercial setting. We have one licensed facility to produce Zolgensma and 2 additional facilities in the US that we anticipate to license in 2021, which will allow us to continue to expand our manufacturing capacity and to deliver more doses of Zolgensma to SMA babies around the world. We're just so excited to have filed for approval in Russia back in July of this year. And we have received orphan status in Russia just a few weeks ago. So now we're in constant communication with the government and health authorities to find mutually acceptable solutions that enable rapid registration so that eligible babies can be treated as soon as possible. We are currently pursuing registration in close to 36 countries, with regulatory decisions anticipated in Switzerland, Canada, Israel, Australia, and South Korea in the latter part of this year or early 2021. We know that diagnosing SMA as early as possible is crucial to stopping the progression of the disease, and newborn screening is the easiest and fastest way to a diagnosis. Without newborn screening, patients often experience months of delay in obtaining a diagnosis. SMA is now a treatable condition, and the community is calling for a renewed commitment to implement newborn screening for SMA at a global scale.